We know that there are 5 types of vertebrae: cervical, thoracic, lumbar, sacral, and coccygeal. So cervical, we know that it supplies to the neck. Thoracic is basically the thorax part and the abdomen part. Lumbar is basically, just remember, as L for legs. Sacral, because right, as that has double S, therefore sacral predominantly provides to the ass part. And coccygeal, you can just forget it for now, although it does provide to the coccyx, that is nothing but the tailbone. Now moving on to the cervical vertebrae, just forget about C1 because there is no C1. C2, C3 for the head and the face. C4 for shoulder. So der and 4 are kind of rhyming. Now for the next part, let's just draw an oval first and then name this C5, C6, C7, C8 and T1. Now let's use this oval here on the hand. So C5, C6, C7, C8 and T1. So the main things that we need to remember here is that the thumb is innervated by the C6 in dermatome and the middle finger by the C7. So we know that we show the number 6 using the thumb, and we know that the middle finger is the longest of all the fingers, therefore 7, which is the longest of all the numbers here between C5 and T1. Now we know that thorax supplies to the thoracic part, therefore let's just draw some 12 spaces here: T4, T5, T6, T7, T8, T9, T10, T11 and T2. Now the main things we need to know in the thoracic cavity would be T4 and T10. Now we know that there are 2 breasts and 2 nipples, therefore 1, 2, 3, 4, that would be T4. And we know that there is an umbilicus right in the center which looks like a 0, therefore T10. So T4 for the nipples and T10 for the umbilicus. We are completely done with the upper body. Now let's move on to the lower body. Now let's talk about the lower body. So for the lower body, we're going to mainly deal with lumbar, sacral and coccygeal vertebrae. So the dermatomes that will supply to the legs are the lumbar, L for legs, sacral because the ass has double S in it, therefore sacral for the ass and the posterior part of the legs, and C for the coccygeal part. So we know that coccyx is nothing but the tailbone. Therefore, the tailbone is supplied by the coccygeal dermatomes. So let's firstly talk about the sacral dermatomes. So we have discussed that sacral dermatomes produce to the ass. Therefore, firstly let's draw a couple of concentric rings and then let's divide the posterior part of the legs into 2. Now the most lateral part of the legs, posterior legs, gets S1 and this one gets S2, S3, 4 and 5 for the rest of the rings. So S1, S2, S3, S4 and S5. We already know that this is the tailbone, therefore coccygeal part. We know that there are 5 lumbar dermatomes, out of which L4 supplies to the knee. Why? Because knee has 4 letters, therefore L4. So this is going to be the L4 part. And everything else goes on top, L1, L2 and L3, and L5 goes to the bottom. Just that L4 also supplies to the medial part of the lower limb and L5 supplies to the lateral part. Just remember that this one tiny toe would be supplied by the S1 area because you already know that S1 supplies to the lateral. S1 is going to supply to the one tiny toe. Alright, so the one tiny toe is going to be supplied by S1, L4 knee, L5 to the lateral part, L1, L2, L3 on top, and this one is S1, S2, S3, S4 and S5. Alright, so just remember S1 to the lateral part of the leg and S2 to the medial part of the leg. Now this is all about the dermatomes of the lower limb.